All right, everyone. So we have Dr. Ben today. Dr. Ben is a biological dentist. I have a feeling you're going to be hearing more and more about that type of health professional because as our society is realizing, we have a lot of issues with our medical system, conventionally and holistically as well. Nothing's perfect. But Dr. Ben, what is the biggest difference between what you do, which is being a biological dentist, and a conventional dentist?
Well, thank you for having me on. First of all, I appreciate you using your platform to bring light to this topic. It's a big passion of mine. Obviously, it's not just a career, but for me, it's also a passion to make an impact in where health and healthcare is being done. I call sick in this country right now. So the way it is being done right now with conventional healthcare, I really appreciate you having me on, Chris. So what's the difference? What's the difference between biological dentistry and in conventional dentistry, which is how we're trained in dental school? There's a number of things. I would say the number one thing is that we look at the tooth and the body connection. Right now, medicine treats patients in silos, right? So there's a heart doctor, and there's a skin doctor, there's an eye doctor, there's a tooth doctor, and so none of them have anything to do with each other. But realistically, as you know, it's all connected, right? Mm-hmm. So for us, we focus on that connection. We, not only is it blood, lymph, nerves, but it's the meridians. We utilize the dental meridian chart that you're probably familiar with, and a lot of all that tune into might or might not know about. So that connection is super important for us because what you do in the mouth has dramatic effects on the systemic health, and the systemic health has, dramatic effects on the oral health because it's, again, the connection. There is the detoxing with a lot of times there's toxins coming, there's a toxic load on the body that's causing health issues. And a lot of times it's the mouth. So we look at heavy metal toxicity coming from metal restorations and other metals that are used in dental restorations. We look at treatments that are done in dentistry that a lot of times are introducing more toxicity causing health issues. A lot of times we are addressing infected root canals that, are a big problem. And I never realized I used to do so many root canals in my career. And in fact, I got extra training doing root canals because I want to do them great. And, but I stopped doing them. I made that choice a few years back, and, I never went backwards on that and other sources of infection. But again, reducing the toxic load, that connection between the mouth and the body, and is big. And root cause, finding for root cause. We don't want to treat patients just by symptoms. We really want to find root cause of problems. And I can get into details about that.
Yeah, I mean, I think what do you think are some common misconceptions about what those root causes can be? I mean, I'll post some things about this topic a little bit here and there, and we'll get into one here in a little bit, kind of talking about cancer. But, I want to kind of get your common misconceptions that I think maybe most people are missing.
I mean, so the common misconception as far as,
I guess like common misconceptions about root causes that could be leading to other systemic issues within the body.
Yeah. Well, let's talk about common one, grinding your teeth. Yeah. Like a lot of times people grind their teeth. It's a very common problem. And a lot of, what we're trained in dental school is if they grind their teeth, you give them a night guard. As a biological dentist, we look a little deeper than that. We look for the root cause because there's a high chance. I was just talking about it with a patient right now who's doing a consult for, when they're grinding their teeth, there's airway issues. And airway issues are directly linked to sleep apnea. And sleep apnea, so studies will show actually more than 40% of patients that have sleep apnea have grind their teeth. So if someone in our office grinds their teeth, we do a sleep study. We don't just give them a night guard, because a night guard could actually be exacerbating their sleep apnea. And sleep, yes, night guard does a good job of protecting the teeth from rubbing on each other. But more importantly, if they have sleep apnea, there's major health issues. I mean, major health issues that are overlooked in this country and just prescribed medicine for. Diabetes, stroke, heart disease, all the number one things that have prescriptions for right now. in this country are actually symptoms of sleep apnea. So if we are not addressing sleep, my brother and I got our diplomats in sleep medicine about 10 years ago because we overlooked. We started training doctors in this topic because medicine completely overlooks sleep apnea. Unless someone's morbidly obese or something like that, they start talking about it. But really, in our practice, is something we talk about all the time. It's a root cause. We have to get to the root cause. So another example would be like microbiome. A lot of times, these microbiome issues are causing oral issues instead of it's not, instead of just focusing on flossing or brushing and hygiene, which is important. It could be oral microbiome that is, it could be imbalance in your vitamin D and K2 and these micronutrients. So these are the things that we have to look at in nutrition and in getting into that. If we're not doing that, we're missing the boat.
So do you guys with testing your patients to kind of rule those things out up front, or do you do it down the road a little bit? Like, kind of what's your process with most people?
Our initial process is, we kind of first, assess what's going on, see where we are. If there's a lot of problems, a lot of inflammation, a lot of cavities, look at that. We have to see what testing should be done. Is whether it's their vitamin D and K2 levels or the oral microbiome testing. There's testing for either one of those, depending on the specific patient. So it's very customized. We don't do it for everyone. Some patients, they don't have inflammatory issues. They have, other issues. So you have to kind of look and see for each patient. But there is technology out there for all this. So it's just that it's not being taught and it's not being utilized.
Why do you think that is? I mean, a lot of people, I shouldn't say a lot, but some people I talk to, they kind of view dentistry as a whole as a bit of a scam. Like they think dental insurance is a kind of a scam. They're paying all this money for a service and then they're having to pay out of pocket for it. And it's just, I think people I've been talking to kind of feel a little bit jaded by that. And so what would you say to that person that's like, maybe on the fence and they're like, hey, I need proper care, but like I'm debating on this conventional dentist down the road or a biological dentist. Like, what would you tell that person?
Well, first of all, I just did a video on dental insurance, and I do think it's a scam. To tell you the truth, I tell my patients there's really no point unless you're getting for free through work or something like that, and it's a little coupon. Dental insurance or any insurance like medical insurance. It should protect you against catastrophic injury,
right?
And big costs. Dental insurance is the opposite. It helps you with little costs, and if it becomes a big cost, it doesn't help you at all. So what's the point? What's the point? Because a little cost you can handle, like cleanings and little fillings. Okay, that's not the problem. If you have to do major work, you're on your own. So where's the, and it doesn't make sense. The amount they pay is only $1,000 or $2,000 a year. So I think it's a scam. To be honest with you, our practice is not insurance based, meaning we'll work with it and we help patients if they have it. We'll bill for them and everything like that and help patients out. But it's not. It can't be about the dental insurance. We've created actually models for membership models and where patients can actually help with getting treatment done and get actual benefit from some kind of a plan, because dental insurance is not great. Now, the other aspect of your question has to do with, industry as a whole, and, it is disheartening because a lot of times, it's like going to a mechanic, you don't know, you just have to trust, right? It's like if you don't know too much about cars, they say you need to change change that, and you're like, okay, you have, I know, okay, or like they say you got to change his crown or something like that. For us, we do a little different. For us, it's all about informing patients together and seeing where things are. We don't just diagnose stuff and tell them we need to do this or you need to do that, and we want patients that are really eager to learn. Where our average patient is someone that's done a lot of research before they met us. They sought us out, they found us, and so they're highly researched. They know what they want. And I love that, because I always tell my patients, don't listen to me. I don't want you to listen to me. I'll give you information, take that information and go do research. Right. Because this is the evolution of healthcare. I think everyone has to be their own health advocate. Yeah. And if if you just tell patients to just listen to you because I'm your doctor, I think it's the worst disservice. And we don't have, what do we, yeah, we have some education, but ultimately patient is in charge of their own health journey. And I would say, you're the driver. I'm here to support you. Okay. So you have to actually drive. You have to be the one that actually has to go and explore everything I'm telling you and understand it deeply, because it's not about cavities. It's about researching why. It's not about just grinding your teeth. It's researching why and understanding it. And then when you really get it, then you're going to make life decisions on a daily level that are right, whether it's nutrition or hygiene or micronutrients or, supplements or anything else that can be help in your journey, or using technologies like biohacks. In our office, we have biohacks in our office too. Yeah. We have hyperbaric oxygen and red light therapy, IV therapy, because these are tools that are current technology that actually help patients reach vitality and longevity. So why not? It's just not being utilized in dentistry right now, but we feel like it should be,
Yeah. Yeah, that's really good. Kind of pivoting a little bit, what do you think the connection is, if any? I think I know the answer is going to be, but what do you think the connection is with oral health and cancer? Like, do you feel like there is a pretty strong correlation there, pretty weak? Like, what's your opinion?
Well, I've been to multiple lectures before, oncologists, and as far as a biologic dentist, we have academies that we go to that all kinds of health professionals come that lecture to us, because it's not just the teeth. So I've had multiple lecturers that come and say, I've never had a patient that had cancer that didn't have either a infected root canal or a cavitation, some kind of infection in the mouth. And you had a video on just recently of someone you were talking to that said something to that extent. And it wasn't the first time I've heard it. It's not something that, and it's not what I've seen. And there's reasons, again, it has to do with the toxic load. Your body has some supreme intelligence. It's amazing, right? And if we have to at least get the toxic load out of the way so that your body can heal. When there is a toxic load and toxic burden, and that keeps accumulating over time, that's what leads to autoimmune disorders, cancers, and other chronic inflammatory health issues that are burdening, and chronic disease that are burdening so many people with chronic disease.
Yeah, and I always tell my clients, the analogy I like to give them is, imagine that there is a car accident. You're in California and you have busy intersections, busy roads. Imagine there's a car accident where there's an accident occurs and you still have all this traffic flowing in. And the analogy is that, like something happens, right? Whether, it's an incident or whatever, but something happens. And then if you don't stop that flow of traffic, which in this instance is the toxic burden, it's very difficult to address that accident site. And so you have to stop the flow, address the accident site, get the flow going after that. And it can kind of resume back to more of this regular routine. But so many people, I think, even the idea of a toxin is such a unknown, what does that actually mean? And what is that, is everything toxic? Is nothing toxic? Does a dose make the poison? All these different conversations. And I think for people become so overwhelming that they're just I'm just going to do what I can do. I'm going to do what's convenient. I'm going to do what makes the most sense for me and my family. But I don't have the time or the energy to kind of, sift through all this information and figure out what I actually need to do. Hence the need, I think, for people like yourself, where it's okay, this is the direction you want to go. You want to improve, you want to heal, you want to overcome, you want to have more energy, whatever. You have pain in your mouth, whatever the incidence is. And it's we're gonna help you address that, but also you want to go to this new direction that's healthier, and you want to live a better life. And then, like you said, helping them steer that ship to where it's this is how we can maybe get you in that direction is really all, myself and yourself are trying to do with people. But it's like you said, it's not because we have a certain education. It's because like that's what our skill set is in helping people kind of get through all that information and trying to help them become the expert on themselves, which is really what we're all trying to do, is just understand our body, understand what it's communicating, and then respond to that appropriately. So I guess with your practice, like you mentioned, you have all these modalities, you have this kind of like whole center, which is really, really cool. What do you kind of hope, or I guess, what are you seeing come from that? Like, as far as patient testimonials, like what kind of results are you guys getting going this route with people?
Well, I think the biggest benefit is the fact that we have this perspective of this holistic health, right? And also the other aspect of it is collaborating with other like-minded professionals, whether they're naturopaths, MDs that are integrative and functional, or nurses, so right, we create a center where we have all those guys on our team. So when they might see a patient, or like, other practitioners in the country that we collaborate with, they might see a patient that is going through some health challenge. So now, instead of addressing just that health challenge, now we can collaborate together and say, okay, let's evaluate and make sure. Let's take a cone beam CT scan. And a cone beam CT scan, for anyone watching this that doesn't know, is a 3D image of your jaw instead of a regular 2D image of a regular X-rays. That we can diagnose toxins, sources of toxicity to that, whether it's cavitations or infected root canals, or other things. So we'll evaluate just their mouth with a cavitation. A lot of times we'll do this through telemedicine for patients that are outside the state. And doctor will refer to us. We'll evaluate, and not even just the doctors in our clinic, but we have doctors that we work with throughout the country, and that we'll evaluate we'll just do a telemedicine call. I just got up one right before I started with you. So we do a telemedicine call, and we'll go over what's going on in their mouth based on just this cone beam CT scan, because we can see so much on that. And then we put a plan together just on as far as detoxing on level. And then a lot of times we'll organize systems where they can come, stay, and go through this kind of health journey for a few days here. And we guide them through this process, both beforehand through nutrition and micronutrients, and then here surgery, and then recovery through the hyperbaric and red light and the IV therapies. We have a whole system, and then kind of set them on a state where they can now heal with the treatment protocols that the practitioner is wanting to go through, whether it's detox, heavy metal detoxing, liver, whatever detox or health issues that we're trying to do, an anti-inflammatory detox, or whatever else. Now, a lot of that stuff we do in the clinic as well with that team, but people are trying to do those things outside, obviously everywhere right now, practitioners. But if we get to the source, like you were saying, I use the analogy where if you're in a room and there's a water pipe broken and water's gushing in, now you can put some towels on the ground and try to clean up the water. But until you stop the source of that water, there's no point in trying to clean up that room, really. I mean, you might want to put some towels out, but ultimately you have to stop the source. So for me, that source a lot of times is coming from the mouth. Unless we look at those things, our healthcare providers out there are missing the boat of a big source of toxicity that is leading to cancer, that is leading to autoimmune disorders, Hashimoto's, other inflammatory issues, arthritis, heart disease, dementia. All these things are now 100% linked to inflammatory issues that come from the mouth. So
let's talk about that a little bit in terms of, let's talk about mercury in the mouth and Alzheimer's. Like what again, I know, like you said, it's linked. Is that something that, because I'll tell it to people and they're like, really? I don't know if I believe that. And it's like, no, like it's well documented. So comment on that a little bit.
Well, mercury used to be a hot topic. When I first graduated from dental school, everyone still was placing mercury. I've been doing this for about 25 years. So, and now, sadly, even given what we know, people are still placing mercury fillings in this. Other countries they're banning it. Europe is banning it. A lot of parts of Europe has already banned it. the Russia banned it in the late 70s. And because these amalgam silver fillings, as they label it, it's they're made with more than 50% mercury. If we had a little bit spilled in a room, we have to call a hazmat company to come clean it up. It's the most toxic material that you can, be around, toxic metal. Now, this is used in these fillings because they last. They're like, oh yeah, put it in the mouth, it lasts. But at what cost? So for us, there's better materials, and what we can use to restore the teeth. So as far as mercury goes, there's no question on the damage it does to the body. And now there's no damage. There's no question of how much mercury is being released. If you haven't seen the video, the smoking tooth, I would say YouTube it, or someone that's viewing this right now, go look up the smoking tooth. It shows the tooth when you rub it with the right background, where you can see the mercury vapors coming off of it. And guess what? A mercury filling in your mouth. Every time you brush your teeth, you floss your teeth, you grind your teeth, anything you're doing that's rubbing that mercury filling, mercury vapors coming off. And that's constantly adding to your heavy metal load. That we all, to some extent, we all have some heavy metals in our body from all these sources. So if we keep burdening that body, that bucket will get full. And as that bucket gets full, mercury is a major neurotoxin. It goes into that bucket. That bucket is usually fatty tissue. And then there it goes into organs. And organs means, yes, liver, kidney, but also your brain. So your brain is where that, a lot of times the heavy metals and mercury go. And in that, now you're looking at all the neurological issues that we just talked about. And then it's a heavy metal, meaning it's hard to remove and hard to do it correctly. So number one, we want to stop the source. But I would never tell patients go remove your mercury fillings, because they're going to go just drill them out by the average dentist. But you got to remove them safely, because if you just drill them out, you're going to get more mercury released, actually. And a lot of times people get sick after that mercury removal process. And then when they weren't before, so you got to do it right. You got to do it safely. That you have trained biological dentists that actually was certified in doing it. They don't teach us that in school. They don't teach us that in school.
So it's not just removing the whole tooth. It's like you have a specific way of extracting that metal.
Oh yeah. Yeah. Because you know what we were taught in school? Just go and drill it out like it's a cavity. And mercury levels in our body as dentists is a problem. I drilled it out like that for half my career. And so I was exposed to it. My team was exposed to it all these years. So, now, after you dig and learn and I learn more for myself and for my team, for my patients, we got certified in removing it correctly. So yeah, I would never tell patients to remove your mercury fillings until you know someone that can do it correctly, because it can make you more sick, actually.
Well, there was a lady in Denver years back, I can't remember when, but she had too many removed at once and it killed her. Like, it actually killed her. It was so toxic for her. So yeah, that's like my story. I always tell my clients is like, if you have this and you want to get rid of it, like, go find a biological dentist, because this is what happened to her. And I'm not trying to scare you, but like, that did happen. So what about, I mean, again, I don't feel it's controversial, but some people believe this is a controversial topic of fluoride. Is there any benefit to using fluoride, and should people be brushing it on their teeth?
Well, there is a benefit, to be realistic. The benefit of fluoride, there is a topical benefit, not ingesting fluoride. Ingesting fluoride, even in dental school, they taught us this. This is one thing they taught us in dental school, is ingesting fluoride has no real benefit, but topically, it can help prevent cavities. Now, so there is that. But for me, as a biological dentist, I'm looking at your overall health, right? I'm not just looking at your preventing cavities, because if you're preventing cavities, at what cost? Because now with fluoride, we also know what else it does. Yes, it might help, with the cavities, but at what cost? We know it's a neurotoxin. It causes, the we know there was just this court judgment at the Supreme Court level, at a federal court level on this topic, as you might know, that they ruled that fluoride is causing issues for these kids, and it's been proved to have reduced in IQ, and brain development. So it's like, at what cost? There's better way to prevent cavities. For us, it's like, okay, there's hydroxyapatite, there's vitamin D. You have to check their vitamin D levels. Like look at their, take some supplements, vitamin K2, magnesium, zinc. These are all going to pull calcium out of your blood, put it into your bone and teeth, make your teeth stronger. Get your nutrition better. All these things that you could do. So why rely on something that's toxic? And
Sure.
and the concept of putting it in the water is ridiculous. Because that doesn't even make sense in any way. But again, there's a history behind why that happened too. But so that's my 2 cents on fluoride.
Yes.
Yes.
Yeah, no, that's helpful. Yeah. As far as order of operations, if somebody's doing their dental hygiene each night and, maybe they're using a water pick, maybe they're flossing, maybe they're brushing, is there a particular order that you found to be the best?
For a night home care? It's I would say I like to floss more first and then brush. But I would say it's not a big difference. Even as far as preventing cavities, I would say even hygiene itself is not number one on the priority list as far as preventing cavities. It's there, it's on the list, but it's not number one. Number one on the list is going to be what you're putting in your body every day. What's your nutrition like? What is your oral microbiome like? Because I don't know if you know about Weston A. Price. You probably know who Weston A. Price was. Weston A. Price. Yeah. So he was a dentist back in the 30s, and he was a researcher, and he went to all these indigenous villages, and he found that the people there that lived not on the Western diet whatsoever had not only no cavities, but had straight teeth. And guess what else? You never had to get their wisdom teeth because they had full jaws, and their expanded full jaws because they developed correctly. Because they just had a natural diet, not a processed Western diet, and they had this toxic load that was actually this burden that a lot of times is transferred from parent to child and constantly passed down, like the heavy metal toxic load that's passed down from mother to child. And so what they had was poor hygiene. So, but they didn't have no cavities, and they have straight teeth, and they had a film on their teeth, but it was not a problem. So, so a lot of times, yes, people I was talking about this with a hygienist. The dentists are focused way too much on just telling people to floss, and you got to floss more. You see bleeding in your mouth, you got to floss more. Now, yes, if you're removing some of that plaque that's sitting against between your teeth, it can prevent cavities. It can prevent, again, gum disease and that inflammation that's happening. 100%. I'm not saying you shouldn't floss.
Sure.
But there's a lot of other things you should be talking about. Sure. You should not be focused only on brushing and flossing. So at home care, yes, I would say flossing is great. Sure, brushing with the right soft bristle toothbrush, great. Even electric toothbrushes that are soft. Some great products out there now. The water pick is great. Oil pulling, I like. Coconut oil pulling is great. So these are things that you can do to help in the process. But if you have a horrible diet and there's your microbiome or microflora thrown off, you can do all that. You'll be still getting cavities.
Have you seen / can cavities heal?
Say that question again one more time.
Can like a tooth heal? Like, because a lot of times they'll say like, hey, once it's there, like it won't recover and heal. Have you seen that not be true?
Yeah, it depends on how big the cavity is. If it's more superficial and small, there's different ways we can help heal. There is, hydroxyapatite is a replacement for fluoride that actually helps remineralizes the tooth. There is, there is other ways. We use something called, ozone, charged oxygen. If there is really small cavities, like in an area, that are you can ozonate it that area and not necessarily, and it kills the bad bacteria that are causing the cavities in the first place. And it's charged oxygen. It's a natural product that's been around for a long time. Used in integrative medicine and biological dentists use it, but mainstream medicine doesn't really utilize it. So there are ways. Again, I think my first step would be to address what's causing it in the first place, and then see what we can do to make some adjustments there.
Have you, is it a bad idea if you swish like hydrogen peroxide in your mouth, like often, occasionally? I mean, is it a good idea to do it at all?
Yeah, absolutely. Hydrogen peroxide, I'm a fan of. You can utilize it in a water pick even. You can swish around with it. It's actually really helpful in killing some of the bad bugs and not the good ones. So I'm all for that.
So you can't do it too often or anything like that? Like if you do it every day, is that a bad thing?
I don't think it's needed to do every day, but I don't think it's going to cause damage either. So I wouldn't necessarily recommend it for every day.
Sure. I guess, in kind of just wrapping up this conversation, I mean, you've said a lot of great things. You've talked about the importance of getting at the root cause. You've talked about the importance of addressing your micronutrients, your diet, your sleep, preventing things like sleep apnea. Is there anything else that you feel like people that you want to communicate that people probably need to know about dentistry and having just an overall healthy body? Like, is there anything else that you want to say to that conversation?
Well, one of the things that's also overlooked quite a bit is the kids. In our office, when we built the new facility, we created a center this facility is about 7,000 feet. So we have a whole section devoted to kids now. And because kids are overlooked, and a lot of times it's pediatric dentistry is only about, in the dental school, they call it patient management, meaning like you just have to try to get in there and do the fillings and get out with as least trauma to the child as possible. For us, it's a little different. Then we realize there's a big void that we need to address as far as the health of the child from early on. And what I mean by that is a lot of times children, besides the nutrition component and the constant toxicity that they're being addressed, around from the foods that they're eating, from the processed foods and everything else. But there's the other thing I mentioned to you earlier about when you don't have all that crap food, the jaw development, and then generationally how it affected Western Day price and everything else. Well, these children in our office, we have a holistic pediatric dentist in the office, and it's part of our team. So she actually will work with kids to not only prevent cavities, but also look at their airway. Now, we talked about sleep apnea for adults, but for kids, this is a big problem too that's overlooked. And when kids, a lot of times might snort, they might not breathe like when they're sleeping at night. They're mouth breathing and they're making sounds while they're breathing. So their airway is obstructed. So there's airway obstruction for kids too. And for kids, it's super important because during sleep time, it's important for adults too, but for kids, they're growing right now. So during sleep time is when growth hormone is released. Now, during sleep time, if they're having airway issues, a lot of times now their mental and physical growth is stunted. So, and if you're not addressing that, now there is behavioral issues, ADD, ADHD, other times, like any child that has ADD, ADHD diagnosed at all, you should be looking at their airway. And it's not done at all. For us, because airway and sleep is a big deal, right? That's a big component of biological dentistry. So we want to look at their airway. And so we look at arch expansion. Remember I said those endogenous people had expanded arches? That expanded arch is so important because then there's space for all those teeth, and also the airway is open. So these kids that have obstruction in their airway due to an inflammatory diet and other reasons, lack of breastfeeding, a lot of stuff that happens through the toxic load from mom and all these other factors, but they can't breathe a lot of times from their nose. So they're mouth breathing, and they have this kind of deficient lower jaw. They're mouth breathing constantly because they can't breathe from their nose. They have dark circles around their eyes. These kids are suffering every night, and they don't breathe well. You can actually you can watch them. They can't breathe, and then they're physically stunted as far as growth. They're mentally stunted, and so it's a huge problem that is so real. And for us, it's so important to start that early, from 5, 6, 7 years of age, so we can start expanding their jaw non-invasively, and so that improve the airway, improve the skeletal structure of these kids, so that now they're set up for the rest of their lives to actually grow properly, grow well, and so that they can breathe, they get proper oxygen, and then their facial structure is balanced and is not defective. So, it's something else that's, again, we're very passionate about, and so important, because these little ones need that attention too. And it's not just cavity prevention and making sure we can fix the cavity. So there's more to that.
Yeah, I love that. That's awesome.
Myofunctional therapy, that's a big thing too.
Yeah. That's the term right there. Well, Dr. Ben, I appreciate it so much. And where can people find you online?
Well, our practice name is my practice name is Smile Body, as you see on my shirt here. And we named it Smile Body because it's about the mouth and the body together,
That's cool.
But on all of our social media, our website, and all our Instagram and everything, it's My Smile Body. So it's at My Smile Body. And so find us there. I do a lot of videos, as you know, on these topics, everything we talk about today. I do these kind of videos because it's important, and people have to hear these things. And so, I appreciate you, Austin, so again, bringing light to this topic. And again, my hope is work together with more like-minded professionals, so we can make a difference, making America healthy again, and have our impact. And another big passion of mine and message of mine is for everyone to really start living their passion. Really not just having a job where you're kind of getting paid to pay the bills. I think our human nature is amazing, and when we live our passion, we're going to make bigger impacts in the world than if we just do a job for a corporation. And for me, that's been my mission here. I'm lucky because I get to live my passion every day. But I think if everyone lived their passion more, did something that they really love, and they can make a huge impact, and we can all together, as far as health goes, make a big impact in the United States, and take us from the bottom of that list of being the most unhealthy people in the world, even though we spend the most on healthcare, to being on top. And there's no reason for it, other than the fact that the constant burden from the pharmaceutical companies and the big food. But we all have to take that ownership and make a change.
Yeah. And amen to that. We should do this again, and I'm going to see kind of what questions pop up from this video, and we can kind of maybe do a part 2 to this, because this is such a good conversation that we need to continue on. So Dr. Ben, again, I appreciate it, and thanks so much for being on the show.
Thank you, Austin. I appreciate you, my friend. Looking forward to next time.